What are the adverse effects of semaglutide GLP-1 receptor agonists? So the physicians who were giving their patients with diabetes semaglutide stopped the regime. 46% stopped because they weren't getting enough blood sugar control. 44% stopped because of nausea and vomiting. And then 37% of patients were stopped because of the GI side effects. Majority of people who take the GLP-1 receptor agonists get some type of abdominal pain. Constipation and diarrhea affect about a third of the people each. Nausea and vomiting affect about 23% of the people. About 16% of people get GI bleeding. Gastroparesis is slowing of gut motility. That occurs in about 5%. And pancreatitis occurs in about 3% of the people. Wegovy is a higher dose of semaglutide that is used for weight loss. It increases the heart rate in 41% of the patients, 10 to 19 beats per minute, and 26% of patients had an increase in heart rate of 20 beats per minute. 67% had between 10 to 20 beat per minute increase in heart rate. Other side effects of Wegovy, the percentages were not given for acute pancreatitis, acute gallbladder disease, retinopathy, and acute kidney injury. Again, the common nausea for 44%, vomiting 24%, constipation 24%, and 6% discontinued because of the adverse effects. In 2005, semaglutide received FDA marketing approval. The first randomized control trials were Pioneer 6 and Sustain 6. They were 26 weeks long and 104 weeks long. People who were in the treatment arm of the study were at higher risk of hypoglycemia, nausea, vomiting, diarrhea, pancreatitis, and pancreatic cancer. You can see the hazards ratio here crosses the null. And so that means that this study was insufficiently powered. And so that means that they need to have a larger sample size. So you can't say anything about those two conditions based on this information. So no human studies have been done to evaluate the effect of semaglutide on pancreatic enzyme production. Animal studies show that there's an increase in lipase up to 55% in a 26-week randomized control trial, and that increase in the production of lipase suggests pancreatic inflammation. There does seem to be a 28% increase in the risk of gallstones in a meta-analysis. No studies have been identified that excluded obese diabetic persons taking Wegovy and assessed for pancreatitis. Diabetes is considered to be a comorbidity of obesity, and so in the studies that I was able to find, it was allowed in those studies, which is like not super awesome for being able to evaluate the risk of pancreatitis, because people with diabetes have a higher risk of pancreatitis. So there needs to be a better study. So this study was about a group of folks who had type 2 diabetes. They matched patients who were on the GLP-1 receptor agonist and an equal number of patients who were not. There was no significant difference in developing pancreatitis at 1 year, 3 years, or 5 years. However, this study did have limitations, which is that they did not control for any change in diabetic diagnosis. And you would expect there to have been some patients who were no longer diabetic at the end of 1, 3, or 5 years. We know this is an important consideration because people with diabetes have a 92% increased risk of developing acute pancreatitis. And so then we don't really know what to make of this study since they did not control for that. So even though the gastroparesis or the delayed gastric emptying is not something that occurs very frequently, it's around 4 to 6% of people have severe symptoms regarding this. Overall, delayed gastric emptying is the function of GLP-1 or GLP-1 receptor agonists, even if it's not something that is discomfort that's reported. So in this study, they measured gastric emptying and found a group of people who had normal emptying and delayed emptying. Those with diabetes mellitus, of course, were more commonly found in the delayed gastric emptying group. What this study found was that gastroparesis was associated with increased mortality, independent of age, sex, body mass index, or diabetes status. And so even if just a small portion of people experience delayed gastric emptying, if delayed gastric emptying is associated with increased mortality, that's not an awesome thing. The other thing that delayed gastric emptying is related to is SIBO, the small intestinal bacterial overgrowth condition. And so that is a very uncomfortable condition that is difficult to treat. So also not an awesome effect of the medicine. So one of the reasons that pancreatitis is an important consideration, even though it doesn't appear to happen in a huge percentage of people who take the GLP-1 receptor agonists, is that diabetes can actually develop from acute pancreatitis. So if you were to take the Wegovy due to obesity and you were not diabetic, it could actually increase your risk of getting diabetes. We know that if you've had 2 or more reoccurrences of pancreatitis, that will double your risk of getting diabetes. And that the probability of developing diabetes after chronic pancreatitis goes up every year. And so this is an important consideration. So microglia are the macrophages of the brain, and they appear to produce GLP-1 and definitely have GLP-1 receptors. What we know about the microglia is that they can act as part of the anti-inflammatory system of the brain. But if they are primed, like in a traumatic brain injury, they can switch from being anti-inflammatory to being persistent inflammatory agents. And so if we know GLP-1 crosses the blood-brain barrier. And so if we are exposing the microglia to persistent GLP-1, I'm wondering if possibly that can prime the microglia and be something that switches them from being anti-inflammatory to being pro-inflammatory agents. I think people who watch TV or YouTube have seen that there's a lot of lean muscle loss in the celebrities who take the GLP-1 receptor agonists. This can be as high as 40% of their total weight that's lost. When the GLP-1 receptor agonist is combined with another incretin, the GIP, the lean muscle mass that is lost can be as high as 60% of your total weight loss. Presently, the cost of Wegovy is about $1,000 to $2,000 a month if you don't have insurance. With insurance, it's around $400 a month. Ozempic, without insurance, is about $1,000 a month. And Ozempic with insurance is about $25 a month.